Hello viewers, my name is Kshitij Anand from ET.com, and today we have with us a very special guest, Ms. Deepika Gandhi, who is representing Cleveland Clinic in India. Cleveland Clinic is multi-speciality, non-profit medical center. It provides medical treatment to patients and offers education to medical professionals across the globe. It is rated #2 hospital in the US. So tell me, Ms. Gandhi, give us an overview about the Cleveland Clinic.
Sure. Cleveland Clinic, like you just said rightly, it's a multi-specialty academic center. It's been in the country since 1921. The main campus is located in Cleveland, Ohio, and we have about 90 outpatient locations throughout Ohio. We also have facilities in Abu Dhabi, in the Middle East, and we also have facilities in Canada, Toronto, as well as Nevada.
Right. So just to give us an overview and to help us understand how exactly is Cleveland Clinic helping patients and medical professionals in India?
Sure. So to start with, Cleveland Clinic is world renowned for taking care of the very complex procedures around the world. Right. Even in the domestic market, the procedures which are very complex and cannot be handled by some of the smaller medical centers get transferred to Cleveland Clinic. Mm-hmm. From an international patient standpoint, we do see a lot of patients for very high-tech procedures, very complex procedures. For example, lung transplants or complex heart procedures. Mm-hmm. And we've had some of the best outcomes in the world for taking care of the sickest of the sick.
And briefly describe your role as part of the Cleveland. What is your basic role?
Sure. So I'm the representative for Cleveland Clinic in India, and I work very closely with patients, patient advocates, with referring providers, with doctors and various healthcare institutions in promoting education as well as facilitating care for our patients. Right. As you know, when patients get really, really sick, they want the best for medical care. And from the point a patient makes a decision to travel to Cleveland Clinic, it is mine and my team's responsibility to ensure that they get the best experience as they travel to Cleveland Clinic. We want to make them as comfortable as possible. We want to make them feel like they're going to a home away from home. Mm-hmm. Even if that means, cooking a home-cooked meal or serving them dal chawal, abroad. We take care of, even the finest, the nitty-gritties, translation services, we help them with travel, accommodation, etc. And when it comes to providers, there's definitely a need, a dearth, and hunger from physicians to learn. That's right. And educate themselves, keep themselves up to date with, what's going on in research, etc. Right. So we as a team help bridge the gap here in India by, providing preceptorships and observerships in our Cleveland Clinic locations to the physicians.
Ms. Gandhi, tell me one thing. How big is Cleveland?
Well, Cleveland Clinic Health System is obviously a large system. We have the flagship hospital is located in Cleveland. It's a 1,400 plus bed facility. Mm-hmm. Then we have about 90 outpatient locations. We have 9 regional hospitals across Ohio. And across the globe, we have a facility in Abu Dhabi in the Middle East. We have facilities in Canada, Toronto. Our physician size, we have more than 4,000 physicians serving about 27 institutes, which are more like departments or service lines in the hospital. And we get patients from across 180 countries across the globe. So definitely, we are a large system and we take care of patients from all over the world and very well equipped to do that. Right.
And you have plans to, reach out to India?
Yes. For India, we're really doing more outreach, with Abu Dhabi location being only a three-hour flight away, as well as Cleveland. No patient is too far away for Cleveland Clinic.
Perfect. I think that's a very optimistic view on that. Perfect. Now, we also talk about that Cleveland offers educational programs. Can you guide us? What is the sort of, how can one enroll? What are the programs available, and definitely how can one enroll for that program?
Sure. So unlike most medical institutions that offer only clinical programs, or they're more focused on clinical aspects of education, Cleveland Clinic is unique in that we offer both clinical as well as what we call global executive programs.
Okay.
Our president, Dr. Cosgrove, is of the belief that, some of the best medical and scientific training also cannot prepare healthcare leaders for the future. And this is exactly where Cleveland Clinic is bridging the gap for training physicians, training administrators, training nurses to transform into visionary leaders. So we have programs that are ranging anywhere from 1-week programs to, fellowship programs that are more long-termed. And in terms of clinical education, we have observerships, we have specialty preceptorships. We really customize those educational programs to the needs and requirements of the physicians. And we've got tremendous positive feedback from folks who have come to Cleveland and our other locations.
So it ranges from 1 week to 1 year, you said?
1 week to 3 months.
1 week to 3 months. Right. All right. So these are all short term. No, there's no long term, and these are on hand programs. That means on the job training, or is just theory? How exactly is it structured?
Sure. So for the executive educational programs, we have dyads of professionals. So we have academicians from universities who teach, and they're paired with industry leaders from Cleveland Clinic. So they bring a very practical approach to solving day-to-day problems and in operations, or handling patient experience, etc. And with regards to the duration of the program, it's very difficult for physicians and administrators to leave their practice and their hospital to come for long-term. So that's where, the duration of the program has been tweaked to the needs of the audience.
And if somebody has to actually go and get himself or herself enrolled for the program, what is the link that he or she can go to?
Sure. So for professionals from India, we have a specific website for the educational programs.
Right.
So either they can reach out to me through the website, or they can directly enroll using the CIME link, which is provided on the Cleveland Clinic website. If they browse for international programs, they can find the link.
All right.
And it's a very straightforward process. It's all online.
It's all online.
Or, of course, I'm there.
Okay. No, perfect.
That's one of the reasons I'm here, to help streamline that process and follow up on requests that come from India, or if there are any custom requests for education.
There's another basic question that everybody would want to ask, that is there any minimum qualification that one has to have before he or she actually get enrolled for the program?
I would say particularly not. I mean, especially for the observerships, it's open to medical students, it's open to junior doctors, it's open to obviously even, senior physicians who are probably more interested in improving, a particular technique of their practice. The Global Executive Educational Program is really open to anyone who's interested in furthering their career and has an interest for learning.
Okay. I also read somewhere that Cleveland got accreditation from President Barack Obama, if I'm not wrong.
Correct, yes. So we were recognized by...
What was that? Was there an event, or what was that for?
No, he just made a reference. He made a visit to Cleveland Clinic when he was the president, and he was very impressed with our program. So, he believed that Cleveland Clinic was, one of the better healthcare systems in the U.S., where we not only focused on outcomes, but we did that keeping in mind patient experience.
Oh, that's a feather in the cap, right?
Yes, absolutely. We are definitely honored by his compliments for Cleveland Clinic.
And another thing which I want to touch upon is I think Cleveland also focuses a lot of emphasis on R&D. How's that coming along?
Well, research and innovation are almost, like the pillars of, who we are. It stands true, to date. I mean, I can just give you examples of some of the pioneering work that has been done in the clinic. As recent as 2015, we were one of the first hospitals to actually do a MRI-guided deep brain stimulation procedure, which has been proven to almost be, the recommended treatment for patients with Parkinson's disease. It is also aiding recovery of patients who are suffering from stroke. And I wanted to make another mention that we were the first in the country, in the United States, to have performed what we call transaortic valve procedures in 2011. This is a procedure where, patients who are not candidates for open heart surgery, the older patients or patients who are much more frail, and who are not direct candidates for open heart surgery.
Right, where there's more risk involved.
Yes. Are they're more appropriate for what we call TAVR procedures. So we've had some of the best outcomes in the country for performing TAVR, and we in fact see a lot of patients internationally, particularly from India as well, for this procedure in Cleveland Clinic.
And any final words that you want to give to your audience about Cleveland Clinic?
Well, sure. Why not? So Cleveland Clinic, unlike most hospitals, I think, where, most hospitals also offer quality, they offer, outcomes. I think what sets us apart is, the culture of, giving and, making the experience of the patient as seamless as possible. Because, we do believe that, patients go through a lot of suffering when they're sick, and this is the time they need, compassion.
Right. So Cleveland provides that personal touch to patients.
Absolutely.
Which helps the speedy recovery.
Absolutely, absolutely. And even for international patients, we have a dedicated center for international patients. So we are very well equipped to handle the cultural differences and the different perspectives that patients bring.
Perfect. I think viewers would have got a lot of information on Cleveland Clinic and how to go about it, especially with respect to medical research programs and the clinics, how to enroll for the program, as well as how to get the treatment done. Thank you so much, Ms. Gandhi, for taking time out for ET.
My pleasure.
It was a pleasure interviewing you. Thank you so much.
Thank you.